you can name some other things. So you're talking about checking doors several times and feeling
washing
insecure.
hands, or maybe combing the hair a certain way, 30 times to the right, 40 times to the left.
Actually counting the time.
Exactly. And if somebody say call their name while they're counting, they have to start over.
Oh my goodness.
Because it's a pattern, it's a repetitive pattern they have to do.
Okay.
Or another one is that people do is, like, for example, have the shoestring the same pressure on each side of the shoes.
Okay.
Of the socks, so they'll be the same length on the legs.
Okay.
And you can imagine if a sock slide down a little bit, they got to kind of be consumed and pull it up and make sure it's equal.
Wow. Okay. So when someone is is like that, it really, for the individual, they feel like they're okay, but the folks who are around them, they're the ones that's being kind of driven up the wall with this behavior.
Yeah, especially if somebody's got to pick you up and take you somewhere, and you're in the house having to count a certain number so many times.
Okay.
In the old days, we had put ice in the refrigerator in the little trays. So if somebody weighs a little water out, they have to go back and fill it up again.
Okay.
So just a simple task of making ice at home can be hours.
Okay. So how can an individual begin to note these behaviors within themselves that are abnormal and to realize that this is a disorder?
Right.
How can a person look at themselves and know when they need help?
Yeah, most patients with OCD, these kinds of symptoms, they know.
Okay.
They're just too embarrassed to tell anybody, but they already know. Much different than somebody that's psychotic.
Okay.
Right. And once they can trust a person, like a coworker or somebody at church or something, then they'll start getting help for it. Or they may tell their primary care physician.
Okay. How are these obsessive disorders and behaviors dangerous? What will be the long-term consequences of allowing these obsessive behaviors to continue in one's life?
Sometimes they can just become so predominant in a person's life that that's all they think about and all they want to do. They would exclude serious relationships, family relationships, and then they even stop working. They can stay in their house all day and just give up their job and everything because they may fear they're going to get an illness if they go outside or touch something. It can be severely impairing.
Okay.
Right.
So they can get from one level to another level of severity.
Yes, sir.
Okay. Now, if a person is able to function every day, keep good relationships, then they shouldn't even bother about trying to get treatment? Is that what you're saying?
Right. If they don't have any social occupation impairment and it's not causing much distress, then they're pretty much all right.
Okay.
If they have internal distress or distress in the household, family, and at work, then they need treatment, need at least an assessment.
At least need an assessment.
Yes,
So, because what you're saying is it sounds like almost everybody deals with it on some level or another. It's just maybe more noted in some people than others. I don't know if you're even familiar with a television program called Monk, where he's got this situation with cleaning and washing his hands, and he's a detective. He's going through solving crimes and all this, but all at the same time he is having trouble, because he's afraid of germs.
Exactly.
Something like that. Okay, so that's someone you can take note of.
Right.
All right. Talk to us then about the treatments for obsessive behavior.
The best treatment is individual therapy with medication. Now, some patients don't like medication, but without medication, it's hard to really treat OCD. But the best treatment is therapy first, or therapy and medication. About 50% of the patients have very, very good response rate. 30% maybe a slight response rate. So we know they respond well to medications and therapy, and there's a small percentage of patients that really do not respond well.